Good afternoon, sir.
Good afternoon.
So my name is Sean Isorano. So today the doctor is going to perform lumbar puncture on you. But before that, sir, may I please know your name, age, and address, sir?
I am Dr. Pena, 25 years old, from Florida.
Okay, Mr. De La Peña, may I please see your name, tag for confirmation? Okay, Mr. De La Peña, so today the doctor is going to perform lumbar puncture on you, and I'm just going to assist him. I'm just going to instruct you on what you're going to do. So the purpose for the lumbar puncture is to determine if you have syphilis, meningitis, cancer, or any neurologic conditions that is likely to you.
Okay.
So we're just going to insert a needle here on your spine or your lumbar area. So, but before that, sir, I'm just going to prepare all. I'm going to do my hand washing, prepare all the equipment needed for the doctor to perform his procedure. Is that okay with you, sir?
Okay.
Okay, sir. Okay, sir. I've done my gloves. I've done my hand washing. I've done my gloves. I've prepared all the necessary equipment for the doctor to perform lumbar puncture on you. Is that okay with you, sir?
Okay.
So first, sir, I need you to sit on the edge of the bed. So it's very important, sir. So I'm just going to use this pillow. I want you to put your hands here, and then I want you to do that, sir. So now, assuming that the doctor is about to insert the injections, sir, this is the first is going to inject anesthesia, and sir, this is going to hurt a little bit since the injection is quite long. So, assuming that the doctor is now inserting the needle on the patient's lumbar area, it's important for me to instruct the patient to straighten his legs while the doctor is injecting. So sir, can you please straighten your legs, sir? Okay, so once I've instructed that, so assuming the doctor is now aspirating, so assuming that this is a sample contaminator, I'm going to I'm going to put this on the side so the doctor can put the sample that he extracted in the patient's spine here. So assuming that the doctor has collected the necessary sample, I'm just going to close this and put this here, and then now I'm just going to remove this pillow on the patient. So, and now I'm just going to position the patient, and I'm just going to put a pressure. Assuming this is, I'm just going to put a pressure area on the injection site to avoid bleeding. Okay, so after that, I'm going to position the patient in a prone position, sir. And it's important that we put the patient on a supine position for 2 to 3 hours. So after doing that, it's important for us to position the patient again in a more comfortable position. And after doing the procedure, it's important for us to do hand washing, do aftercare, and make sure that the sample that we collected is put in the laboratory for examination. So sir, thank you for letting us, me and the doctor, perform lumbar puncture on you. Okay, sir, thank you.